afternoon, Professor. My name is Stephanie Jamie.
My name is Lola Rodriguez.
My name is Laisa Min.
And we are presenting Chapter 5, Strategic Capacity Management for the Shoulders Hospital.
And now Stephanie's going to start with the introduction and with question number 1.
Alright, so before I introduce you to the Shoulders Hospital case, I want to briefly mention the definitions for this chapter. Capacity is the output that a system is capable of achieving over a period of time. In this case, we'll be analyzing the expansion of the hospital's capacity to determine if either to serve considerable unsatisfied demand by adding one more day of operations or adding another floor of rooms to the hospital. Another thing that we'll be using is the capacity utilization ratio, where this is the measure of how close the firm's current output rate is to the best operating level presented by a percentage. And this I'm going to show you in question number 1. So, for the background of Shoulders Hospital, it is established by Dr. Edward Earl Shoulders in 1945, known for as the inventor of the Shoulders repair. Originally, it helped young men who were unable to enlist in the military because of their hernias. Dr. Shoulders' unique repair method improved surgical results and reduced recovery time. This is where it is globally known for its excellence in hernia surgery after demand was increasing for Dr. Shoulders' remarkable techniques. Specializing in external abdominal hernias has resulted in early ambulation, meaning getting up from the operating table and ability to walk, and higher success rates greater than 99% for Shoulders patients. This hospital is not just hernia healing hospital. It provides an experience for the clients with a country club atmosphere, gregarious nursing staff, and a built-in socializing for an unpleasant medical problem. So firstly, I want to get down into the breakdown of the hospital and what it provides. So firstly, each patient undergoes a screening exam prior to setting a date for operation done between 9 in the morning and 3:30 in the afternoon, Monday to Friday, and 10 in the morning to 2 p.m. on a Saturday. So overweight or undue medical risk patients are refused treatment. However, the remaining patients receive confirmation cards with the scheduled dates for their operations. It is then transferred to the reception desk once an arrival date is confirmed. So, after arriving at the clinic a day before the surgery, there is a brief pre-operative examination and completion of any necessary paperwork. Once settled in the room and introducing themselves to their roommates, the orientation begins at 5 p.m., followed by a dinner. Patients gather at 9 p.m. in the lounge area for tea and cookies. At the end of the day, patients go to bed between 9:30 in the afternoon and 10 in the afternoon. Well, actually at night. On the day of operation, the patient is administered to a local anesthetic, leaving him or her fully aware of the operation. The hospital offers an ambulation where the patient can walk from the operating table to a nearby wheelchair to return to their room. After the operation, the patient is able to rest, exercise, and have cookies and tea with their new patients in the lounge. So the information that this case provides is the hospital has 90 beds averaging 7,000 operations annually. The medical facilities consist of 5 operating rooms, a patient recovery room, a laboratory, and 6 examinations rooms. So with this, there's 150 operations per week with patients staying at the hospital for 3 days. Doctors operate only 5 days per week, and there is 12 full-time surgeons and 7 part-time assistant surgeons. So to get to question number 1, it is how well is the hospital currently utilizing its beds? So when I was saying previously of the information that we have 90 beds. So let me say here 90 beds easily. Okay, let's go 90 beds. We have 90 beds, and then there's 7 days per week. So we want to multiply that to the beds. side gives us 630 beds per week. Okay, so right there we have 90 beds times 7 beds equals 630 per week. That is the total number of beds available per week. Now we want to know how many beds can be utilized for 3 days. So what we have here is 30 patients. We want to multiply that by 3 days. Let me get another marker because it's running out of ink. Okay. So multiply that by 3 days. Times, and we want to multiply that with 5 doctors. We have 5 operating rooms. This would give us the number of beds utilized for those 3 days in a given week. So 5 doctors, which equals, so we have 30 times 3, which is 90. 90 times 5 gives us 450 beds. Now with this, as I said earlier, we have the capacity utilization ratio. This is going to give us the capacity used divided by the best operating level. So therefore, in all, we're going to be using utilized beds divided by the actual beds that we have in the hospital. So actual beds, which equals utilized beds, what we calculated here, which is 450 beds, divided by the actual beds, which is 630, what we have in a given week. So 630, we divide that and we get 71.43%. So with this 71.43% of capacity utilization ratio, if we were to increase the rate of utilization, it might decrease the service quality. Okay, so with that, I'm going to go ahead and pass it on to my colleague to answer question number 2.
Okay, during the second part, I'm going to talk about the future plan of the company. In this case, the hospital is planning they want to expand the hospital to serve considerable unsatisfied demand. To this effect, the Vice President is seriously considering 2 options. The first option will be add Saturdays to the existing 5 days schedule, which will increase the capacity by 20%. And the second option is to add another floor of the room to the hospital, increasing the number of beds by 50%. This will require more aggressive scheduling of the operating rooms. So, and the second exercise said, develop a similar table to show the effect of adding operations on Saturdays. Assume that 30 operations will still be performed each day. How will this affect the utilization of the bed capacity? Is this capacity sufficient for the additional patient? Okay, so basically we're going to use the same table that we have in the exercise. The only thing is that we're going to add some numbers so we can calculate the average capacity utilization with the new information. So we're going to have here here we're going to add 30 because we're adding 30 hours, and also inside. Okay, so from the first exercise, we calculate that the capacity utilization rate was 71.42%. Now, with the new information, we're going to calculate the average capacity utilization. Okay, so we're going to add information for each day, and then we're gonna do the calculation, and then we will have the final answer with this information. The total here will be 85.71%. Okay, so this will be the new average capacity utilization. Okay, with this new number, they show that the utilization of the best capacity will increase by 85.71%, which means that will still be enough for the additional patients. Okay, so for the third question, the question is, now look at the effect of increasing the number of beds by 50%. How many operations could the hospital perform per day before running out of bed capacity? Assume operations are performed 5 days per week, with the same number performed in each day. How well will the new resources be utilized relative to the current operation? Could the hospital really perform this many operations? Okay, so in this case, okay, the first thing that we're gonna do is we're gonna calculate the capacity for each bed. I'm gonna do it in this part. Okay, so we have that in total 50, 100, beds. We have in total 135. Since the 12 full-time surgeons operate 4 patients a day, the maximum number of operations the hospital can perform in a day will be this amount. The number of surgeons is 12, so will be in total 48 operations per day. Okay, the hospital cannot perform those many operations in a day because with only 5 operation rooms, each room will have a carry-out operations. The working hour of the surgeon is 8.5 hours per day. So this means that with each full-time doctor operations on the best working hours, they will not be able to perform all the 9.3 operations. So now Laura's gonna respond question 3.
This will be the last question, number 4, and the question is, although financial data are sketchy and an estimate from a construction company indicates that adding bed capacity will cost about $100,000 per bed. In addition, the rate charged for the hernia surgery varies between about 900 and 2,000 US dollars, with an average rate of 1,300 per operation. The surgeons are paid a flat of 600 per operation. Due to all the uncertainties in government healthcare legislation, Schultheiss would like to justify any expansion within a 5-year time period. So I'm just going to explain two scenarios, and this will be the first one. So we have a bed capacity increased by 50%, and the total number of operations in a day would be 50% times 30. Plus 30. So this will be 45 bed capacity. And then we have the cost of expansion that will be 100,000 and times by 15, which it will be and then with the average cost for operation being 1,300 per operation and the wages of doctors that would be $600 per operation. So if the hospital will increase the operation to 45 in day, the net income can be calculated as gross income minus the surgery wages. So it would be gross income is equal to average cost number of operations, and it will be 1,345, and it would be 58,500. And then the wages will be 45 times 600, and it will be 27,000. And then for the net income, then will be this, which will be 58,500. Minus this. So my net income would be 31,500. So this is a scenario 1.
We'll erase this part.
Okay, so with this scenario, when the total number of operators per day is 30, which the average cost for operation being 1,300 per operation, and the wages of doctors is $600 per operation, the net income is also derived by subtracting the surgery wages from the gross income of the hospital as follows. So it would be gross income, it will be equal to average cost times number of operation. So it would be 1,300 times 30, which will be 39,000. And then, since the surgeon's wages is still the total of 27,000, as we did on the scenario 1, then the net income would be the same. So we have 39,000 minus 27,000, and it will be a total of 1,200, sorry. So by saying this, by comparing both scenarios from a financial standpoint, Schultheiss can use the higher returns to justify its expansion. Unlike the current return of 1,200, by spending the hospital stands to gain a gross profit of 19,500, which is 32 32,500 minus 12,000 per month. So with an annual gross profit of 378,000, which is 31,500 times 12, the payback period will be, okay, so let me just write this down. Okay, so I was just saying the annual gross profit of 378,000, which is 31,500. Sorry, I was missing 1 0. And will be, so capital we have now for expansion divided by and it will be, this was what we got here, and it will be so by saying this, therefore the investment opportunity of expansion we have paid off before the end of the 5-year period that we were analyzing. So there are different options that the hospital can perform to satisfy the market demands. The first option will be the creation of a new building to expand the hospital. Second, add Saturday's operation or adding a new floor. The creation of the new floor will allow the hospital to continue maintaining its quality and control, as well as allowing the hospital to increase the number of available beds to 45 beds. In our opinion, the best solution for the hospital will be to add Saturday's operation in the schedule. By making this change, economies of scope will insist on producing products at a lower cost. In this scenario, there will be no cost construction or hiring new staff. And the unfortunate side is that the employees will have to get used to the new schedule and the changes that may occur to better opportunity with the hospital. With this change, the hospital will be able to increase its capacity to 1,500 per year, solving their issues with running at maximum capacity. So this was all, and